So, one of the first things that I want to discuss, and one of the most commonly asked questions that we get, is why are we the TMJ and Sleep Therapy Center? How are there were two related, or why would you choose these two things to treat? And the reason behind that is a lot of people don't actually realize that TMJ disorders or pain and issues in the temporal mandibular joint here can actually be caused because of an untreated sleep disorder. And so, what do I mean by that? It was always thought that bruxism or grinding of the teeth or clenching activities such as that were because of stress or just purely because of psychological issues. And over the years, as we tried to understand more about bruxism and more research has come to light, yes, there is a component of it that is stress, and that may be more associated to daytime bruxism or clenching or posturing of the jaw forward. Nighttime bruxism or nighttime clenching or grinding of the teeth seems to be more associated as a protective function. And what do I mean by a protective function? So when we sleep at nighttime, we have our airway, right, which takes air from the outside world and brings it into our lungs so we can get to our tissues and oxygenate, and so we can live, right? We need to breathe in order to live. In humans, however, this little tube, right, between the outside world and into our lungs is made up largely of soft tissue. And what do I mean by soft tissue? There's no real bone or rigid structures that keep our airway open. So what we have are our tongue and muscles that are expected to do all of the work to dilate or keep that airway open. It's a lot of work for these muscles. And we don't just have one muscle that does it all. We have about 20 different muscles that all have to work together to keep the airway open. So what does this have to do with the jaw joint? So when I say clenching or grinding at nighttime is a protective function, what we're finding with the research is if your airway closes off, let's say you're sleeping and your mouth is open, your jaw is hanging open, your tongue's falling back, and your airway is occluding, you're not getting breath in and out, what do we need to do? We need to move the jaw forward in order to open up that airway. So again, a lot of nighttime bruxism isn't necessarily due to, stress or stress-related things. Some of it, and a lot more of it, as the research is coming out, is finding that it's actually because we're trying to posture our jaw forward so we can open up the airways so that we can breathe appropriately and properly at nighttime. So if you tend to clench or grind or brux your teeth, and you tend to do it more at nighttime, meaning you wake up in the morning and you have more soreness, I would suggest that we look more into the sleep component of that for you. It's not necessarily true for every person, but for the vast majority of my patients and the people that we treat, we do notice there's that very strong correlation between the two. So I think if you kind of fall into that camp where your jaw and pain seems to be worse in the morning versus the later afternoon hours of the daytime. So we know we're doing a lot of activity at nighttime while we sleep. It's a good idea to consider what your sleep quality is like and consider getting that evaluated. And of course, that's something that we do and we can help you do. We work with sleep physicians, ENTs, a whole team of medical community, so that we can get you sleeping the best and get you out of pain. And if we need to do further evaluations of the sleep, we have multiple ways that we can do that. Home sleep testing we can do, as well as working with our sleep physicians in the community to make sure that we're getting adequate results and testing done for you. So I hope that sort of elucidates or clears up for you what the correlation between TMJ issues, especially in the nighttime clenching and grinding and sleep, and why we are actually the TMJ and Sleep Therapy Center. So any questions, please let us know. Any comments, anything like that, you can always reach us via email as well at info@clevelandtmjsleep.com or our website, clevelandtmjsleep.com. So I hope you found this useful. Thank you.